I will let Bill take over.
Thank you very much for the introduction, Kim. Really appreciate the opportunity here. Yeah, as Kim said, my name is Dr. Phil Finemore. I own WorkFitME Mobile Physical Therapy, where I help busy Maine professionals to maximize their physical performance so they can live a happy, healthy, and wealthy life doing what they love with who they love. Really excited to be on here with you today. We're going to be talking about some sort of common causes, symptoms of rotator cuff injury and how we can treat pain from rotator cuff injury, but also how we can prevent it. Okay. And that's the real key thing here is even if you don't have any active shoulder pain going on, you can still take care of some things that we commonly see lead to rotator cuff pain and injury down the road so that you don't get to that point. And that's very key, that a lot of these things can be prevented. They typically come from very preventable causes, and we can do what we can to fend this off if you don't have pain in your shoulders. But if you do have pain in your shoulders, some of the stuff we go over today can help that out as well. A couple of housekeeping things here. If you do have questions, I'll definitely save time at the end for a general Q&A. But if you have something that's really about what we're talking about in the moment, don't be afraid to pop it in the chat. If it makes sense to kind of answer it as we go, certainly willing to do that. And if not, we can certainly save it for the Q&A, but don't be afraid to throw the any questions you might have in the chat. So let's actually start with a little bit of that. If you feel comfortable sharing this, you can either use a little thumbs up reaction here, raise your hand or throw in the chat. If anyone currently dealing with any shoulder pain, if you feel comfortable responding to that going on. Yeah. Okay. Yeah. So it's a pretty, a couple people. It's a pretty common thing. About 80% of shoulder pain comes from the rotator cuff ultimately. Okay. There are other structures in the shoulder that certainly can cause pain, but the most common thing is the rotator cuff, either inflammation in that area or even potentially tearing in that area as well. And we'll get into this, but conservative treatment can be very effective for tears. So tearing in your shoulder, in your rotator cuff, does not necessarily automatically mean you have to have surgery, but we'll get into that. So common things we tend to see when we have some rotator cuff stuff going on, and this might be true for some of you. Just even getting your arm up overhead can be painful, right? Another biggie is putting your arm behind your back, like tucking in your shirt, or for women, clasping a bra behind your back can be very, very difficult. Any sort of lifting out in front of you, even at shoulder height, can be very difficult, like reaching into the refrigerator or especially up into like a cupboard, getting something heavy, that can be painful as well. Sleeping on it tends to be painful too, something that people with shoulder pain don't like to do. Common areas we tend to see pain, even though your rotator cuff is really up here pretty high in your shoulder, the pain tends to be down along the upper part of the arm. That's a what we call a referred pain pattern. So even though the problem is about in here, you can feel pain down that arm. Some people feel pain a little further down the arm than that. It's a little more uncommon. And usually when something like that happens, there's more of a neck component going on. But that's another thing we'll get into, because there was a pre-webinar question that came up that sort of relates to that. So that's something we'll definitely get to in the Q&A. But those are the types of things that we tend to see. So if that speaks to, what some of you that do have some shoulder pain are feeling, some of this stuff can definitely help you. And again, even if you're not feeling shoulder pain, a lot of the things we're going to go over today can help prevent that from becoming a problem for you. Okay. So I'm going to share my screen real quick, give you a little background information about the shoulder and the rotator cuff. This here is one of this little purple image here is one of my favorite studies. It's called the vomit study. No, not that kind of vomit. It stands for Victims of Medical Imaging Technology. Okay, so you can read this part about the shoulder here. 20% of adults have partial tears. 15% have what we would call full thickness tears. So this is just random imaging. This was done in people who don't have pain going on in their shoulder. And that number gets higher as we get a little older. At 60 years old, half of people had rotator cuff tears on an MRI that they didn't even know about, meaning they probably most likely did not have pain with those things and had a tear there. So it just goes to show you our body is a master compensator. Okay, it's gonna figure out the path of least resistance, and depending on, we're going to talk about some imbalances that can lead to this over time today. But depending on some of those causes and where some of this comes from, our bodies can kind of compensate for it pretty well. But some of these things can lead to pain over time the longer they stick around too. This is one of my favorite stats. Professional baseball pitchers, 40% of them had either partial or full thickness rotator cuff tears and had no pain while playing, and remained pain-free for 5 years after the study. So to my knowledge, no one on here is a professional baseball player. And obviously the things that those folks work on are at a much higher level than what the average person is working on. But what that goes to show us is that through good conservative treatment, which professional athletes are certainly getting, even if we have tearing in a rotator cuff, that does not automatically mean that surgery is imminent, that it's an absolute necessity for us to treat any pain, whether it's from tearing or whether it's from inflammation that goes on in that rotator cuff. So those are just some good things to keep in mind. These are very common injuries. They happen over time slowly due to some pretty preventable causes, but they are very common. They do happen, but it doesn't always mean that tearing is the cause of your pain, right? It could be inflammation as well. So I want to share my screen again here, and I'm going to show you an image just to give you some background and some sort of anatomy of what we're looking at here. So if you look at this top picture here with the blue background, we've got the front of the shoulder, the front view of the shoulder here. This is the back view of the shoulder here. So your rotator cuff is made up of 4 muscles and their tendons. Okay, you have one muscle that's on the front of the shoulder blade here, one that sits right on the top. That's that supraspinatus muscle right there, and then 2 on the back side. Okay. The one thing I don't love about this picture is the where the supraspinatus attaches and where these 2 muscles back here attach is really more in a very common area. They attach much closer together than this picture shows, but this was the really the clearest picture that I could find to demonstrate this. But all of those areas, all those muscles attach right in your similar area, and you can see all of them travel under this little arch right here, made up of your shoulder, your shoulder blade and your collarbone or clavicle. Okay, so where those 2 meet, there's a little arch right there. All of the tendons of that rotator cuff sit right underneath that arch. Okay, so that's important as we get talking into how some of this stuff can happen over time. Okay. It's a very small space in there. There's also a structure called a bursa, which is just a little basically a fat pad that sits underneath there for protection. So that space is very small and very full. The primary role of that rotator cuff is to help hold that ball and socket joint of the shoulder in a good stable position, help it move the way it's supposed to move within that joint when we're moving our arm around, and help stabilize us with rotational, hence rotator cuff, and diagonal type movement. So each one of those muscles does certain movements somewhat on its own, but the rotator cuff is really more important as a unit, with all 4 of those muscles working together to kind of stabilize a joint that's pretty unstable. The shoulder joint is best described as sort of like a golf ball sitting on a tee, right? The ball is a lot bigger than the socket. So that rotator cuff is real important for stability. And when it's not working so well, for a variety of reasons, which we'll get into in just a second, it can change, again, the mechanics of how that shoulder moves. And by the rotator cuff itself not working very well, it can put more stress on its tendons in that space, okay, and put a little bit more impingement. Everybody heard of the term impingement before when talking about the shoulder? Some of you with shoulder pain might have been told that it is shoulder impingement that's causing your problem, and we'll get into that in just a second as well. But we've already talked about how common these injuries are, and the reason they're so common is because there are certain muscle imbalances that take place that start to change how that shoulder moves when we're doing things with it, especially at and above shoulder height, that wind up putting more stress on that rotator cuff when we're moving it and asking it to work. Okay, so that's the combination of things, right? Where those muscles and tendons are pulling and working, and we're putting more stress on those tendons in that little small space that we were talking about. So I'm going to show you a little bit more about that space here. So we're going to look at this picture right here. So I told you about that bursa. That's that little green thing in this picture here. And that's called that subacromial space. So that rotator cuff sits right underneath there, that bursa. And if our rotator cuff isn't working well and our shoulder blade isn't moving the way that it should, as we raise that arm overhead, we get increased impingement in that area under that arch. Okay. I say increased impingement because in a few different places within your shoulder motion, everybody gets some impingement. Okay. So I don't like to classify it as a syndrome, like impingement syndrome, which some people do classify it as, because everybody gets some impingement when they move in various ranges of motion of our shoulder. But when it's happening earlier and more often as we raise our arm overhead, again, because the mechanics of this shoulder joint and shoulder blade aren't working properly, that's when we run into sort of some repetitive stress and even repetitive trauma of that rotator cuff. And that can cause inflammation that we get stuck in and possibly tearing over time as well, which is definitely an option. I just want to make sure I want to share one more time here, but I want to make sure we're all seeing the right picture here. So this picture here also shows the mechanics of how the shoulder joint and shoulder blade work together. Okay, so this is important factor of why that impingement happens sooner. So we should have 180 degrees of motion of our shoulder joint up overhead. 120 of that comes from the shoulder joint itself. About 60 degrees of that comes from our shoulder blade opening up as we move our arm overhead. It also has to tilt back. Okay, so if it doesn't tilt back a little bit and open up, that can be something that closes down that space that we were just talking about. Okay, so that's an important example, or something important to sort of show you and go over, that we have a lot of things, a lot of moving parts here. No pun intended, right? We have a lot of moving parts here that have to work in concert together to make sure that we're not putting a lot of stress on that rotator cuff. Okay. So any major questions so far about a couple of those things? I just want to make sure we all sort of get the basics there and understand that the way that joint moves and the way that the shoulder blade moves with that joint, how the rotator cuff works, is all very important in how it can get inflamed over time. Great. So the area that we're going to primarily look at that causes more of that stress in that small space where that rotator cuff sits is how that shoulder blade is moving when we move that arm overhead. Okay. Because in my experience, that's the most common cause for just sort of everyday life leading to pain in the shoulder. Okay. And it all really relates back to our posture. Okay. How many of us, we can show of hands again with the reactions are in the chat. How many of us were told that we needed to sit up straighter in our lives or change the positioning, right? Yeah, pretty much everybody should be raising their hands at this point. And although posture isn't everything, and there's actually no such thing as perfect posture, that's another webinar. Kim, we can plan that another time. But in this case, positions that a lot of us tend to hold for longer periods of time tend to create some imbalances that lead to changing in how that shoulder and shoulder blade move together and puts more stress on that rotator cuff. Okay. So here's a big example. If we're working on a computer or a cell phone all the time, right? And we're always in kind of a rounded and forward position like this, our shoulders are up and elevated a little bit. Certain muscles in and around our shoulders and chest that connect to that shoulder blade, different parts of that shoulder blade, change how that shoulder blade moves. Okay. So if we get really tight up here and we get tight in here, that actually tips our shoulder blades. If my hands here are my shoulder blades, tips them forward and down when they need to be back and opening up as we move. Okay. What that also does is takes muscles that help us open up, tilt back and open up when we move our shoulder overhead. It stretches those muscles out, makes them weaker, and makes our body not use them, right? So I talked about our bodies being compensators, master compensators. So eventually when those muscles aren't working well, our brain goes, well, forget you. I'm going to figure out a different way to move, and starts using muscles that feed into those proper mechanics more often. Okay. That causes that repetitive stress to be happening at that rotator cuff in that space. It's just kind of jamming in there earlier and often, and can cause inflammation over time. So I want everyone to try this. Okay. I want everyone to sit up as tall as they possibly can, as tall as they can. And if you have a shoulder that's painful, don't use that, because I don't know how irritated that shoulder might be. So use an arm that feels okay. Sit up as tall as you can and just bring your arm up overhead, just straight up overhead as far as you can. See how far you can get it. Very good. Good. And come back down. Now I want you to just sort of relax and sort of slouch down, right? And you don't have to like make it aggressive either. And then go ahead and try to move that arm overhead again. It's less motion, and you probably feel a little pinch, right? Did everyone feel that? So that right there, it's a bit of an over exaggeration, right? But that's essentially what's happening in those shoulders as we get tight here and here, and the mechanics around that shoulder changes. Okay. We're just pinching a lot more. We don't have as much motion, but we still have things in our life that require us to reach higher and further. Right. And we just get a lot of repetitive pinching on that arch, right where that rotator cuff sits. Okay. So the rotator cuff being made up of tendons and ligaments are not areas that heal themselves, right? They don't have direct blood supply. They do kind of where it meets the muscle, but they don't in the middle, like right in the middle of those tendons. There's no blood supply there. So if they get inflamed or even start to tear a little bit, our body can't really repair that itself, because it can't get all of its own healing properties to that area of tearing to actually heal itself. So that's why, and some of you might have experienced this too. We could do another show of hands. How many of you had this maybe come and go a little bit, but eventually the pain just came and has stayed and has lingered and hasn't really gone away, right? That is because we have that repetitive stress going on. And if we haven't taken the repetitive stress off of that rotator cuff while we're moving that arm around, getting the right muscles activated, getting the right muscles strong and more endurance again that haven't been used in a while, we just stay in that cycle of stress and impingement, which causes more inflammation and pain, which causes some of those muscles, especially in the rotator cuff, to shut down and not work well, which changes our mechanics, which causes more impingement and repetitive stress and pain. You see that we kind of just spiral downwards there, right? And we don't break that cycle. Okay. So what we need to do to effectively treat and prevent this is make sure we're breaking the links in that chain that are going to improve our mechanics, take the stress off that rotator cuff. And if we have pain there, allow that stress and inflammation to calm down, give it more support, and then get the strength and endurance back in the correct muscles around the rotator cuff and the shoulder blades to make sure that that doesn't keep happening again. Okay. So it's a progressive thing that happens somewhat naturally over time when we tend to hold certain positions a lot, but it's going to be a progressive thing that we can get out of over time if we address all of those things the right way. Okay. Are there any major burning questions so far that makes sense to address now, or are we good to keep rolling? Yeah, good. Okay, awesome. So, the main things we're gonna talk about today, anytime we're talking about anything like this, where it's sort of a slow progression of things over time, anytime we're talking about treating pain, we have to find a balance between mobility, stability, and then working into strength and endurance. Okay. And it really starts at the ground level of getting the right areas moving better and getting the right areas woken up and working again. Okay. Because we're dealing with some things that have been getting tight over years and years and years and years and years, and muscles that have not worked properly for potentially years and years and years and years and years. Okay. So I'm going to go through a few things with you today that are sort of the foundational things that can help if you're having some active pain, just to sort of kickstart the process, lay the foundation a little bit that we can then progress from. But these are also very good things, again, from a preventative standpoint. So if you don't currently have a lot of pain, or you have some off and on, but it tends to go away, working on these things might prevent it from coming back to a degree. Again, this is sort of the foundation, but I'm going to show you a couple stretches and one little muscle activation exercise that can kind of help kickstart this process a little bit, whether we're talking about treating some pain or preventing it from happening. Okay. So I'm going to share my screen with you again. Oh, actually, I've got to pull something up first, and then I will share my screen with you. Okay. All right. So these are the two stretches that we're going to go over. So these two stretches hit muscles that attach to the shoulder blade and then up to the neck, that tilt that shoulder blade forward a little bit and rotate it downward. Okay. And remember, we want it tilted back and rotating upward. So these two muscles I find are the most commonly tight in this area. And by all means, please feel free to take a little screenshot of this, either with your phone or with your computer, so that you can have these. I'll leave this up while we go through each of them. So this is I just want to get this out of our way here. So these two muscles, the upper trap, which is this bigger, bulkier muscle up here on the shoulder, and then the levator scap sits right underneath that. It attaches to the top of the shoulder blade up to the neck, kind of runs in this area here. So on this person here, it kind of runs right along there. Okay. So we'll start with this upper trap stretch, because we have to get this down before we can get the levator scap stretch down. If you're sitting in a chair, you can hold the bottom of the chair that you're sitting on. Okay. Whichever arm is holding the chair, you are tilting your head gently away from that arm, and you're going to stop right when you start to feel a stretch. Okay. So for me, if I've got I'm putting my hand in my pocket here, not letting this arm move, I'm a little tight here. I'm already feeling a stretch right there. Okay. And should be a nice comfortable stretch right out through the top of the shoulder here. As it says on the screen there, you're going to hold 20 to 30 seconds. Now that stretch has already died down for me, so I can go a little further. Okay. After that 30 seconds, you're going to come up, you're going to switch sides. Same thing. Stop when you start to feel a stretch. Hold there. If the stretch dissipates, you can go a little further until you get that stretch again, but we don't want to crank into this. Okay. If we crank too hard on tight muscles, they can kind of almost spasm back at us a little bit, and that can cause some pain and discomfort. So we want to ease into this. Okay. So you can do that, 3 rounds of 30 seconds, 5 rounds of 20 seconds. That works as well. And you want to be doing that 2 or 3 times per day. Okay. The levator scap stretch, you're going to be in the exact same position, but you're going to tilt away, and then you're going to look down towards your armpit. Okay. So it's important to tilt away and have your head and your nose pointed down toward the opposite armpit of the side that you're stretching. And you're going to feel that more down the back of your neck into your shoulder. Not as much out over here, but more down the back of the neck into the shoulder. Again, stop when you start to feel the stretch. Hold for that 30 seconds, 3 rounds, switching sides each 30 seconds. And you can do that 2 to 3 times per day. Two of the times that are best to do this in my experience, first thing in the morning as you're getting up, moving around during the day. Last thing right before bed, because what are we usually doing right before bed? We're watching TV, reading a book, messing around on our phone, right? We're in some of those sort of static, sedentary positions where we're feeding into these areas being tight again. Good to kind of loosen them up and open them up first thing in the morning, last thing before bed, so that we're not getting pain through the night as much, right? And then one other time during the day, lunchtime is usually a good time, right? Right before, right after you finish eating your lunch, throw those stretches in. You've got three times per day right there. There's another strategy I like to use that I call micro stretching. Okay. So the doing 3 rounds of 30 seconds 3 times a day is actually going to help us build flexibility in that tissue that we're stretching, in that muscle that we're stretching. The micro stretching is the same stretches, but you just hold each side once for 10 seconds. And you do that every 1 to 2 hours during the day. Okay. That is not going to increase flexibility. It's going to help you maintain a little bit more of the flexibility that you get from stretching 3 times a day. But what it does is it just increases some blood flow to that area. It gives the nervous system in that area a little positive input, and it just gets us out of some repetitive, stressful positions that we tend to be in during the day. Okay. So right now, some of you might be at part of the work from home crowd, or you're a reader, or you're on your phone a lot, right? Those are all positions that tend to put us in spots where these muscles are going to tighten up. So getting ourselves out of those positions a little more often during the day can be very helpful to sort of retrain our body and our nervous system where we want to be a little more often, to just take a little stress off those rotator cuffs when we're moving around, and those muscles from getting tight, right? We're trying to work out of that tightness and that pattern that we've been in for very, very long periods of time. So that's a good strategy there as well. So the next thing we're going to get into here is more of that muscle activation that I was talking about. Okay. We're going to come back to this one in just a second, but first we're going to dip down here to what are called here on the screen, the scapula depressions. Okay. So all we're doing with this is, if you're sitting up nice and tall, you are gently bringing your shoulder blades down and back. I describe it like you're putting your shoulder blades in your back pockets. Okay. So it's not a big motion. If you can see me in the top right-hand corner of your screen, that's all it is. It's a very small motion. You shouldn't be arching your back. You shouldn't be feeling it down through the mid to lower part of your back. You should be feeling it. There's a small muscle that runs here to here that we're activating when we do this. I really wish these arrows were a little more diagonally, but this was the best, clearest picture I had here. It should be a little more down and back, not as much together down and back, just down and back. Holding for about 3 to 5 seconds, and you can do about 30 of those in a row. Okay. I tell people to do this one about 5 times a day. Okay. Again, that repetition of, let's tell our body to wake this muscle up and support us in that good open position. Okay. And allow our nervous system to be talking to that muscle a little more frequently. So the muscle that we're activating here with that exercise is a muscle that helps tilt back and open up the shoulder blades when we move overhead. Okay. So those 3 that I've given you so far, the first 2 stretch muscles that are overactive and put us here. And then the other one gets a muscle woken up and activated that puts us here. So the combination of those 2 things is going to help sort of open up the chest, relax the shoulders, so that as we're moving overhead, our mechanics at that shoulder are a lot better, right? And if you remember back to when I had you sit up nice and tall and come overhead, that felt pretty comfortable, right? That shoulder moved pretty freely and felt pretty good. So that's what we're trying to improve and support a little bit, right? Because I can tell you all that you should be here, but if you can't get there because muscles are too tight and other muscles aren't working, it's not realistic that you're going to be able to replicate that all the time, right? So we've got to give that a little bit more support. Okay. Little bonus here. This doesn't have as much impact on the rotator cuff, but it's good to go over to help with some of the postural stuff, is this little chin tuck here. Okay. Again, I put that it's a small motion and don't crank on it in capital letters because people tend to do this a little too vigorously, and it can again pull on some really tight muscles and actually cause some like headache, pain, and things like that. And we want to avoid that. Okay. But you can see in the picture, she is moving her whole head and neck straight back. So it's in a nice straight line with her shoulder. It's a small motion, but I'll turn to the side here and you can see what I'm talking about here. So it's straight back. Okay. So I'm not leading with my head. I'm not leading with my chin, just straight back, just like that. Okay. So again, holding about 3 to 5 seconds. You can do about 30 of those in a row. If it's really hard for you to do that sitting up, you can actually do it lying down and push your head straight back into a pillow and make sure the whole back of your head and upper part of your neck are pushing into that pillow. That can be a good little correction there as well. But that's another one that you can do very frequently throughout the day. Again, just to help support a position that's different than the positions we tend to hold ourselves in, get some good flexibility through these areas and get some postural muscles working in our neck that will help hold us upright a little bit more effectively. Okay. Everyone good with that? Any major questions on those couple of stretches and activities that we talked about? Okay, awesome. Yeah, so those are the major things. Just to recap, rotator cuff injuries are super common. Tearing does not mean surgery. Tearing does not mean pain per se, and these happen. The rotator cuff injuries, inflammation, tearing happens from some very preventable causes, right? Just changes in our posture and our mechanics over time, changes in how our body's moving, puts a little more repetitive stress on that rotator cuff when we're moving, and can get us stuck in that pain inflammation cycle, possibly lead to tearing as well. But if we correct those things, we can take a lot of stress off the rotator cuff. We also have to get the rotator cuff a little stronger and give it a little more endurance as well. That's a huge piece of the puzzle. But I find that those few things that we just went over are a great place to start for most people from a prevention standpoint, and as an initially treating some active pain that is going on as well. Okay. So I think at this point we can definitely move into the question and answer part. Any specific questions that have come up? You can either write them in the chat or you feel free to unmute yourself and ask those questions. I know we did have a couple of questions. I'm going to try to pull those up on my.
I was actually, Phil, I have them.
Oh, perfect.
Is rotator cuff injury generally the root cause of tennis elbow?
Okay, that's a good question. I wouldn't say it's generally the root cause of tennis elbow. However, it can be a contributing factor to tennis elbow. Okay. If the rotator cuff is not working properly and you're not stabilizing well up here, and you're doing a lot of repetitive tasks that you then have to compensate for in other areas of your arm because the rotator cuff is bothering you, it certainly could lead to some overuse in those forearm and wrist muscles that attach the elbow and cause some inflammation at the elbow. This was the question I alluded to near the top, that we have to differentiate a little bit. I talked about pain that goes past our elbow, not necessarily being from the rotator cuff. The nerves that come out of our neck and go all the way down our arm, again, they start up here at the neck and they travel all the way down the arm into the hand. Sometimes pain coming from nerve issues gets somewhat improperly diagnosed as a rotator cuff problem or a tennis elbow problem, when that really isn't the culprit at all. It's more nerve irritation or compression going on. So that's something, if you're someone who has pain here and here, and it almost like travels and goes down past your elbow a little bit, you might not, even though things like gripping and moving your arm hurt, it might not actually be tendonitis. It might actually be some nerve irritation. And there's ways we can tease that out and tell which areas that's actually coming from. But it's usually things like tennis elbow and rotator cuff tendonitis are only really accompanied together. The populations that I would typically see it in, or think I would see it in, are like throwing athletes. That's when that can become a problem, because mechanics are wrong up here and they're putting a lot more stress on their elbow. That can be part of it. I'm not saying it's out of the question, but you might have something in the neck or this area through the chest and shoulder going on with some nerves that's causing more of that problem that we would need to tease out in order to fix that correctly.
Okay,
Yeah.
great. That was a really good answer. How do you, like, you need me to tell you that was a good answer? Anyways, how do you repair? How do you repair? Very complete.
Yeah.
How do you repair, fix, meet a possible torn muscle in your upper arm leading to your shoulder?
Yeah. So, as we've talked about a little bit today, I think I might have answered this some with what I've talked about. Even if there is tearing in your rotator cuff, now sometimes the biceps part of one of your biceps tendons can be involved as well, because it attaches in a similar area. Actually, let me show you that real quick. Just gotta move this in this little groove right here. Okay. So your rotator cuff attaches in this area, in this little groove, one of your tendons of the biceps is in that area as well. And that can potentially be frayed or torn as well. But with tearing, again, it doesn't necessarily mean you have to have surgery, right? We can get other areas around that rotator cuff and in the shoulder blades and our postural muscles working better to take stress off of that area. That's not necessarily going to fix the tear, but if we can prevent that repetitive stress and trauma from happening to that area, we can take a lot of the pain away. I've had clients who have known partial or full thickness tears in different tendons of their rotator cuff, even multiple tendons of the rotator cuff, and we can get them to be able to functionally use the arm. It might not be perfect, but we can get them to functionally use the arm without pain, right? For some people, surgery makes more sense, right? Some of the people that I've worked with in that realm are in some of the older age brackets, 65, 70, 75 or older, and surgery, they're just like, not really the best option. If you're 30, 40, maybe even 50 years old and you're pretty active, maybe surgery is a good way to go, but conservative treatment's a good place to start, because worst case scenario, you're going to be a little stronger and more mobile heading into surgery and a lot less restricted by not having surgery. Rotator cuff surgeries are very restrictive over very long periods of time. There's certain timelines we have to meet before you can even start moving and all that good stuff. But so to truly fix the tear and make sure the tear isn't there, yes, you need surgery to repair that tear. However, to get rid of the pain from that tear, you don't absolutely have to have surgery, but it's a case-by-case basis.
I don't know if you saw the other question that came in. I have been told I have tendonitis in my shoulder. Even though I do my PT exercises, the pain is still there. Is it normal for it to take months before it gets better?
It can. It really depends on, again, the root cause for you and what those exercises are addressing. That's also a case-by-case basis. The other thing that I always work with all my clients is, yes, we give them exercises. Yes, we give them stretching and a regimen to keep up with in that regard, but we also have to be applying some of this to our day. Okay. So good example, that shoulders down and back position. The reason I tell people to do that 5 times a day is because I want them doing that while they're driving, while they're working at their computer, while they're cooking dinner, while they're putting dishes away or reaching to the top shelf of their closet or whatever the case might be. Working some of those things into your day is really important, because if you're pretty good about doing your exercises, and you feel good while you're doing them. But then when you're not doing them, we're not incorporating some of those things into our daily activity. We're still putting that stress on that rotator cuff. Okay. Another thing right now, I'm not sure if the, Liza, you asked that question. I'm not sure if you're in like a work from home situation right now, but if you are, your body mechanics, right, which is where that shoulder blades down and back thing comes in, that chin tuck comes in a little bit, along with your ergonomic setup, those two things together might really need to be addressed. Okay. So ergonomics alone won't fix it, because if we have a real good ergonomic setup, but we still tend to be in these positions all the time, we're just feeding into that movement pattern. That's part of the problem. So we need to combine those two things together. Okay. So that might be a good place to start for you. Because again, it's the things that you're doing. It's likely, again, without knowing the whole situation, the things you're doing between when you're doing those exercises that's sort of keeping you in that pattern, right? And this stuff does take years to develop. Okay. The tightening up of these muscles we talked about, the weakening of the other muscles we talked about, take years and years to develop. So there, in most cases, there's no one thing we're going to do that's just going to take care of this problem. So it can take quite a bit of time, but applying those exercises and those positions that those exercises get you in to your day to day, and addressing some of the activities you do that can cause the pain or that lead to the causes of the pain is super important as well. Yeah, really important. Great question. All right, another one here. I'm an LMT and recently had a client with rotator cuff pain, classic referral pain. They're an electrician and do a lot of overhead work. Yeah. Interestingly, compared to what I normally find, rotator cuff pain, the teres minor and infraspinatus seem to be the source of the pain. Is the activation exercise bringing the shoulder blades down and back most helpful for them? That's a great place for them to start, for sure. Susan, that's a great place. And not only just working on that, but then thinking about doing that when they do go overhead, right? Because remember when we slouched forward and raised up, we had a lot more pinching going on and some discomfort too, right? So keeping the chest up tall, keeping those shoulder blades down and back a little bit while working overhead is really important. That person is definitely going to need some strengthening of the rotator cuff though as well. They need to get that rotator cuff activating along with some of those postural and shoulder blade stabilizing muscles in order to get rid of that pain. I'm guessing they've got a lot of tightness up here, but if you're digging in that area and helping them, you can maybe show them those two stretches so that the work that you do with them is, they're not losing it, right? They're not losing that mobility in between their visits with you. And but yeah, I've just not too long ago worked with an electrician on this, and because of the work they do, it can definitely take a little more time than the average person because they are overhead so much. But if they stay consistent with all those things and we're able to progress them through a good strength, endurance, and stability program, even with the type of work they do, they can be pain-free and they can maintain that pretty effectively with the right program too, for sure. Another question here. Can a course of prednisone help with the inflammation? It can. It's definitely something to chat with the prescribing doctor about. I'm not a pharmacist or a prescribing doctor, but what I do know about prednisone is that some of the side effects are somewhat unpredictable and can be somewhat, I don't want to use the word severe, but it involves a lot of areas of your body. Okay. It can affect a lot of areas of your body. So, that if you have a lot of inflammation going on, and that's something that needs to be done to kind of kickstart things and really calm that inflammation down so that you can do some more things that'll help actually treat the cause of the pain more effectively, that can be great. But with anything we do like heat, or some of you have maybe heard of like TENS units or electrical stimulation or pharmaceuticals, those help kind of mask the pain you're going through or help with some of that inflammation in the case of prednisone. But we really need to treat the root cause or it's just going to come back, right? So we need to get all those muscles moving better, those other muscles woken up and active, work on the strength and endurance of the rotator cuff, all that good stuff, in order to treat the root cause and prevent this thing from coming back. Yes, Susan. Yeah. And I can put my, actually, I'll do that right now. I can put my contact information in the chat as well. And by all means, they can reach out if they have specific questions, or if you do as well. Either one of those are great ways to get a hold of me. Yes, wonderful. That's for anyone can write those down. We'd be more than happy to chat with any of you after the seminar as well. Another question here: can acupuncture help? Sure, yeah, it can. Again, that is more of a pain control thing, right? It's not necessarily going to take us out of that pain inflammation cycle, again, without addressing some of those mechanical issues going on. But when used in concert with improving all of those things that we've talked about today, yeah, it can be a tool. I'm certified in what's known as dry needling. It's the same needles that an acupuncturist would use. I look at it more from a pain trigger point perspective, right? So in acupuncture, their theories are a little bit more of, movement of energy. They treat things like, irritable bowel syndrome, things like that. I use it more for the treatment of pain, getting blood flow to an area, reorganizing the tissue to kind of calm it down, and have an effect on the way that our nervous system perceives and tells us about pain. But different philosophies, same needle. Okay, I guess is the best way to put it. I don't use it a ton for people with rotator cuff problems unless they've got a whole lot of tightness and guarding going on up here, and I feel like it's a good way to release it. But again, anytime I use needling with anybody, no matter what I'm treating them for, we're doing the needling along with changing the body mechanics, the daily habits, the ergonomics, improving some of that muscle activation and stability, right? It's a piece of the puzzle. Just like the prednisone question. If you feel like you're really in need of kickstarting that anti-inflammatory process and you need something like ibuprofen or other NSAIDs or prednisone, sure, in the short term that can be great, but we want to be getting back to the root cause of the problem, which isn't the pain, it's why the pain is there. And that's what we're looking to treat, for sure. Great question though. Awesome. Let's see. Jen, Cassie, Sue, Susan, any other questions before we wrap some things up and let you get back to your Wednesday, your St. Patrick's Day? Awesome. So before Kim wraps it up, I do always like to extend just as a thank you to people that join my workshop. If you do want to do a bit of a screen or have me take a look at anything, I do offer a $100 visit discount. So it'd be an $80 visit to just kind of go over things and see where you're at and see where you need to go and develop a plan more specific for you. So by all means, shoot me an email with your contact information, your name and your phone number, a little bit about what you want to work on, and I can definitely reach out and give you a call, and we can set that up. So if you're interested, you can shoot me an email. If you want me to reach out to you and you're comfortable, you can also throw your email in the chat here, and I can reach out to you as well. But yeah, don't be afraid to reach out, and would just like to extend that to you all if that's something that you are looking to do.
Thank you very much, Phil. As we said a couple times, this is going to be posted on YouTube, both Phil's YouTube and Coastal's. I'll be posting our link to it on our Facebook page and in the event. And then we'll also be sending a follow-up. I'm sure Phil has some parting thoughts in the follow-up email that we'll be sending. So you guys enjoy the rest of your day. Thank you very much for attending.
Yes, thank you, everybody. Thank you very much, Kim. This was great. Thanks, everybody.